for 1 and 3 buccal with your mirror. So you have to, I just say, go along the occlusal surfaces till your mirror goes behind the maxillary tuberosity. This is the easiest way to retract up here. And then just scoop it out and look at it like that, bird's eye view, kind of upside down and backward. All right, over here it looks like this. Run it along the occlusals till you're behind the tooth, behind the maxillary tuberosity, and then swing it out so that you're looking upside down. Don't be up here because you can't see it as well. Be behind and under that terminal, and as you come up forward, and then when you get to the premolars, it's a lot more comfortable for the patient if you switch to your finger. If you forget during a test, we're not gonna kill you on it, all right? You're gonna find when you work on each other that you tend to, as you're working, you tend to forget, and your mirror's digging into the alveolar bone up there. So when you start to work on each other next semester, make sure when you're the patient that you say, your mirror, killing me.
Why do you palm the mirror instead of putting it down?
Because I don't, time and ergonomics. I never set my mirror down for the whole appointment, ever.
Okay.
Ever, for 45 minutes, however long I'm in the mouth, my mirror is in my hand. And with a piece of gauze too, right here, so I don't have to go for that either. Because time and motion, the seconds are gonna matter.
Mm-hmm.
They are. Yeah. The only thing I don't like about dental hygiene, as I always say, is the clock. Okay, so first of all, retraction with the mirror, all right? 1 buccal, Explorer, okay? All extraoral, the whole thing. Easy, all extra. We're talking fulcrums now, ready? Explorer, 1 buccal, all extraoral fulcrums. That's the easy, okay? With the 1516 Gracie, again, easy, pretty easy, okay? You can go extraoral for molars, and then you come intraoral behind for premolars. And watch your parallel. Even if you start the buccal like this, by the time you come in, you got to lift your hand to get parallel in the proximal. Because that's kind of what we all do, right? You even do that with the Explorer, really. Okay, so mesials behind. Just so you know, on a human, you can usually get in the mouth on the first molar, and it's going to be a stronger fulcrum, right? But for testing, it's easier for you to remember just to stay extraoral for molars, intraoral behind for premolar. Okay, 1 tooth behind, just make sure you're safe, which you will be, all right? That's an easy one. Gracie, 13, 14, you do the distal of the terminal, okay, so it's looking in the mirror, watching your tip. You do the distal extraoral, okay? Then when you come in with this one, you do it the same as your mesial. You stay behind, okay? Because if you did it like the sickle and you went like this, how are you gonna get parallel? Can't, this is wrong, those of you who are filming, okay? It's awkward. So you stay behind for the Gracie, for the premolars and the canine, because it works better. If all of a sudden your hand feels ridiculous, check it, right? Okay, so those are Gracies, pretty straightforward. Behind when you come in the mouth, right?
So we do it behind the distal of the terminal molar.
The Gracie and the Explorer,
but not with the scale.
correct?
Okay.
Not with the sickle. Sickles are meant for proximals, okay? And if you do it back there, it's just going to keep slipping off the calculus. Remember, when you use a Gracie, you're on the root, and the tissue holds you in. But if you're just trying to get that off, it's just gonna be useless. We're gonna teach you how to do those beginning of next semester, how to do terminals. Okay. Mesial, okay. Again, extraoral for mesials, just like the Gracie. Come in, just like the Gracie. Okay, same. Okay, this is the weird one. That's why it's starred up there. This is the distals are the weird one. Okay. you had practiced yesterday, right? That you're gonna fulcrum on the linguals, correct? Back like that, okay? You can, if you want to do the whole thing that way, all right? You can with the sickle, or you can go extra oral until you get to the premolars, all right? Or you can do the whole thing. The video shows the whole thing like this, and that's fine, okay? If it just gets confusing, like every other one is extra oral for the scalars, okay? But this does work good. Okay, so here's, it comes, now your fulcrum for the sickle is lingual. Lingual a little bit in front, but stay lingual, because our concern is that you would come right into your finger. We tend to slip with sickles more than Gracie's are way up on the roots. You know, and you're not pushing that hard, you're just pulling right out. They don't tend to get you. Sickles tend to get you, so it's an unsafe situation if your fulcrum's not safe. Okay, so here's lingual, stay safe. Really lingual, not even cusps. I would say really, really lingual to be safe. Here's the weird one. The canine is impossible to do this way. It's just, there's nothing, and you're gonna slip right into your finger. So when you get to the canine, you're gonna bring it up like you're doing two facial toward, because it works better. This is unsafe, and it's really unsafe, and it's super weak. So just when you get to the canine, just bring it up here, and you'll feel it. It works, and it you know. So there's just some weird fulcrums for the distal with sickles, right? Okay.